Namaste all. I welcome you all to the 59th session of GURUBODHA. I extend a warm welcome to Dr. M.B. Gururaja sir. I also welcome Dr. Raghuram sir to this session. I dedicate this and all of my works at the holy feet of Dr. A. Chandrasekhar Udupa, and this class is made live available only for exclusively for Easy Ayurveda weekly class subscribers. If you want to sign up, please go to easyayurveda.com/video-classes. So this link and link to consult Dr. Gururaja, etc. are available in the YouTube in the video description. So coming to the topic of the day is three main liquids which are widely used in a variety of skin diseases. Have some amount of rakta shodhana or blood detoxification effect as well with all these things. First one is Khadirarista, Mahamanjistadi Kashayam, and then there is this Sarivadyasava. So all are very useful in treating a variety of skin diseases. So question to Gururaja sir is that clinically, which one to choose when?
Yes, typically these three are indicated in skin conditions, but we need to understand based on the ingredients present in that, Khadirarista is more suitable where Kapha Pradhana skin diseases are there. Kapha Pradhana skin diseases, like if there is any oozing associated with severe itching, palpable mass-like skin structures, if it is, at the time of examination, if you could get it. So in those type of conditions, like lichen planus or something like that, so Charma Kushta, what we call. So such type of conditions, it is Khadirarista is the drug of choice, the first one. Second thing, Sarivadyasava. This is typically where Pitta dominant skin conditions are there, where there is a burning sensation, where there is a paka or something wound, ulceration, and there is a oozing associated with that. So in that type of condition, the better choice would be Sarivadyasava to bring the coolness or reduce the Pitta or Vidabdata of the Pitta to be reduced for that purpose. Then there is another one combination like Mahamanjistadi Kashaya. It is exclusively containing more number of ingredients, and this is more suitable for wide range of population, because when it comes to Sarivadyasava or Khadirarista, at least below the age of 8, we don't recommend, at least below the age of 8, we don't recommend for those things. But many times we find a lot of patients of that young kids and these type of thing with atopic dermatitis or eczema. So in those conditions, definitely it will be Mahamanjistadi Kashaya would be a better option. And of course, we have got another one drug, Gururaja Kashaya, one more versatile one. Mahamanjistadi Kashaya is once again used or picked in all those conditions where Pitta is dominant associated with Kapha. So where there is a Pitta Kapha combination leading to skin diseases, where in those conditions Mahamanjistadi Kashaya is useful. And of course it will be useful for every people, including the diabetics, because it is a Kashaya, it doesn't contain any sugar in it. So and it is suitable for even the young children. It is the most widely used material, Mahamanjistadi Kashaya. And of course, Mahamanjistadi Kashaya, such type of things usually where there is a like diabetic carbuncle or pidakas or something like that. Such type of conditions or Yavana pidaka or even to Kaksha to some extent. So such type of condition, Mahamanjistadi Kashaya also useful. But if it is a younger, elder population, then definitely along with this combination we have got many other wide ranges of medications like Mahatikta Kashaya is also there, Arakvadadi Kashaya is there. There are plenty of combinations are available. But when we consider only these three for the time being, then Khadirarista should be selected where there is a severe itching. Khadirarista should be selected where there is a Kapha predominancy. Khadirarista should be taken where there is some palpability of skin conditions are there, oozing associated with that. Such conditions, Kapha dominant one, associated with Kapha it may be something, but Kapha is dominant. Such conditions, Khadirarista is the best. Then comes wherever there is a Pitta dominant and there is a irritation associated with burning sensation or ulceration, oozing, then paka, there is a tissue getting melted out. So such type of condition, better is Sarivadyasava. But in a patient who is a diabetic or a very young one, then the best drug would be, yoga would be Mahamanjistadi Kashaya.
And if there are many varieties of diseases, and an young Ayurvedic doctor may or may not, at least in his initial days of practice, may or may not be able to appropriately identify the skin disease. In those conditions, based on the symptoms presented, they can be categorized as, Vata Pradhana Kusta or Pitta dominant skin disease, etc. And line of treatment can be drawn with just the dosha analysis and the symptoms presented, sir.
That is the best method or the best way to do it. When we are unable to identify the disease by its name, or maybe we can't give a name to that disease, the Acharya Charaka's very clear concept is there: identify the doshas involved and accordingly treat them. That is the best method. Even in Kusta also, we find a lot of things are there. That's what even Acharya Charaka also very clearly said. There are only 18 varieties of kustas are mentioned only for the sake of mentioning, but there are many number of kustas. There are n number of kusta has been declared. Any skin condition maybe falls into the category of kusta, and definitely we need to understand whether there is a kapha dominancy. Then definitely there will be excessive itching will be there, and if there is a pitta dominancy, then there will be burning sensation, pidakas, and oozing will be there. And if it is vata dominance, there will be a lot of dryness associated with itching. So we need to understand these things. Whenever there is a itching and a dryness, it is a kapha and vata. Where there is oozing and itching, then it is kapha dominant. Like eczema, there may be severe ulceration is also there, tissue damage is also there, along with that oozing is there, but severe itching is also there. Or eczematic conditions, or weeping eczema, we can say. Those conditions, it is predominantly kapha and pitta. Whereas a dry type of eczemas are there. It is simply itching, like atopic dermatitis. Comparatively, it is only itching and somewhat redness. And of course, there will be dryness and flaky things, or ichthyosis, the scaling is, the peeling is up there. So such type of condition, it is predominantly vata as well as kapha. So in those conditions, typically we need to select those drugs accordingly. So wherever there is excessive itching, first choice would be Khadirarista, followed by Mahamanjistadi Kashaya. And the last choice is Sarivadyasava. So among these three, where there is a paka or where there is a pidaka and all those things, then the first choice would be Mahamanjistadi Kashaya, second would be Sarivadyasava, and third would be Khadirarista. And wherever there is a burning sensation, the first choice will be Sarivadyasava and rest will follow.
Yeah, so that point you made, Dr. Heba, like Gururaja sir also explained, the dosha dominance analysis, you have typed it there. I think if our Ayurveda students are taught in the initial condition of their clinical practice, when they are in the internship, to do this much, I think it will be quite enough. At least they should be able to identify the dosha involved in not only kushta, any disease we take, and dosha predominance and treat accordingly. So according to the predominance of the dosha, most often than not, they'll be getting good results. So that is a valid point. So teachers should be focusing towards at least training them initially. The first step of identification of diseases, dosha involvement, and the treatment, and the herbal combinations or the herbs which are very, very useful for particular doshas or individual doshas or combination of doshas. So I think that is a valid point there. So coming to these three wonderful formulations, Khadirarista, Mahamanjistadi, and also Sarivadyasava. So I would like to touch it from a different perspective. So like we will go through the Phala Shruti also. When we go through the Phala Shruti of Khadirarista, we can see it is the best medicine in Mahakushtas and also Rudroga, Pandu, Arbuda, Gulma, Granthi, Krimi, Kasa, Shwasa, so many conditions. So very Sarva Kushta Nivarana is the tricky word there used at the end. So if anything doesn't come to your head, so while prescribing for the kustas or the skin disorders, start with Khadirarista. So our Ayurvedic students are very familiar with Khadirarista, if not anything else. Suddenly if skin conditions come, so first thing they're going to write is Khadirarista without even looking at the dosha. So initially there will be a response, because when we see the spectrum there, it is connected to so many disorders. Sarva Kushta Nivarana is written, no doubt about that. You can see so many spectra of diseases there. Mahakushta, Kushta itself being a Rasa Raktavaha Srota Dushti disorder, and Rudroga is there, again Rasava Srotas disorder. We have Pandu, we have again Rasava Srotas disorder. So Gulma, again seeing through these things, there is Krimi. So Krimi along with Kushta, ideal combination. So immediately the infected skin diseases, Krimi is there, Mahakushta is there. If we can correlate, if we can build up a spectrum, so if we can draw a line between these conditions and see. So most of the answers, so our formulations will be So we can keep them ready as one formulation where I can use in 5-6 different conditions. So that is also an easy way of practice. So see here, there is krimi, so there is kushta. So wherever there is krimi manifestation and kushta manifestation, instead of giving two different formulations, we can go with Khadirarista. So simple, common sense tells that. So then coming with the skin diseases caused due to circulatory disturbances, Hridroga is there due to circulatory disturbances. Pandu is there, anemia. So we know that if there is Pandu, that itself leads to a broad spectrum of diseases, which also includes kushta. So because Pandu leads to loss of immunity, and loss of immunity leads to many types of skin disorders. So in such conditions, we can give linking the things. What I'm telling. So one common conditions associated with skin disorders will be the bronchitis and also the asthma. So what I've seen in my practice, those people. My father himself was a patient of asthmatic bronchitis, and he had severe eczema and skin conditions. So here we have two conditions, Kasa, Shwasa, Sarva Kushta Nivarana. And in such conditions where Kushta is associated with Shwasa and Shwasa is associated with Kushta, Khadirarista becomes an ideal choice again. And we also need to see see these things. So what is the indication? So for the best of the results, so here in the shloka, I think it has been indicated to be given with Pipali Churna and Gugudu. So if we can combine these things, I think it will become a wonderful combination. So moving on to the next formulation, so that is Mahamanjistadi Kashaya. Again, looking at from the perspective of Phala Shruti. So here also Ashtadasha Kushta, almost all the Kushtas, it is Ashtadashastu Kushteshu Vata Raktardite Tata. So we note that these two are the bridge conditions. Vata Rakta and Kushta are the bridge conditions. So when whatever we think we are diagnosed it as Kushta and our medicines are not working out, I tell my students, go on the lines of Vata Rakta. So suppose you diagnose some disease called as Vata Rakta and your formulations are not working, go to the Kushta Prakarana. You will get formulations which are interchangeable, just like Rasayana and Vajikarana are interchangeable. Formulations for Vata Rakta and Kushta are interchangeable. So we will find, so these two are the bridge conditions. So like medicines common to Vata Rakta and Kushta can be used. And the Phala Shruti itself tells Ashtadashastu Kushteshu Vata Rakta Ardite Tata. What do we need? So Mahamanjista, best medicine in Ashtadasha Kushta. So Khadirarista was in Mahakushta, at least 7 types filtered out. Here all types of kushta. Again in Khadirarista there was a trick. At last Acharya tells in Sarva Kushtas it can be used, specifically in Mahakushta. Again Vishesha Siddhanta comes there. So here we can see a wide range of other conditions like Upadamsha, Shlipada, Pakshagata. We can see very importantly, we can see Prasupti and Pakshagata. So mainly the Vata related conditions also. Medoroga, so the opposite conditions, Meda related conditions, Upadamsha and also Shlipada we have. So Netra Roga is a broad spectrum. This is a medicine used in different conditions. So it depends on how we diagnose and where we go it, and whether this is itself the medicine of choice. So as I said, Kushta and Vata Rakta being the overlap conditions. So my medicine of choice will be Mahamanjistadi. So in these two conditions, Kushta and Vata Rakta. So when there is a bridge between these two conditions, like one condition we can take, there is psoriatic arthritis. Psoriatic arthritis. Arthritis goes on the lines of Vata Rakta. Psoriasis is going on the lines of Kushta. So there is an overlap of these conditions. There are many conditions of psoriatic arthritis where there is no skin lesions at all. There is only pain. So we can think about Mahamanjistadi Kashayam in this particular context. So we can also see that it is also a nervine tonic, seeing that it is useful in Prasupti and Pakshagata conditions. So that also improves the microcirculation to the central nervous system and also to the nerves. So that is one thing I feel which acts in the blood-brain barrier. So like it can reach the brain and also the central nervous system and also the nerves, and it can also be a nervine tonic. So by the indications, going by the indications strictly. So Pakshagata, again, when we go to the Samprapti, we can see the involvement of Sira and Snayu there. And Sira and Snayu are definitely related to Rakta and Mamsa. So when we consider all these things again, we can see how Mahamanjistadi can be useful in Pakshagata. So from the Samprapti perspective also. So it is useful in bad lipids mainly. So when I get conditions of hypercholesterolemia or triglycerides when they are high, so I will definitely look at Mahamanjistadi Kashayam. So Medavruta Vata, in such conditions also we can give. So here high cholesterol. So we know circulating fats. So here we can see Medo Dosha. There is Medo Dosha, there is circulating Meda. So it may be considered as Abadda Medas also. In Prameha, this can be given. When we are seeing Medo dosha, we know when there is fat accumulation or circulating fats, they can do a lot of damage in the system. They can accumulate, they can block vata and cause conditions like pakshagata and other things, stroke and other conditions. So seeing those conditions, my prescription will be also in these conditions. Okay, in couple of conditions where the medicines for prameha were not working. So I have even tried Mahamanjistadi Kashaya, where skin conditions and also the joint conditions and also the muscular conditions were present in prameha. Mahamanjistadi was my choice, and I found good results. So coming to the final one, Sarivadyasava. So here we can see a lot of conditions like excessive sweating is there, burning sensation, allergies. So mainly in allergies, most of the conditions I think Gururaja sir has touched upon. From the Phala Shruti again, Vimshati Meha, a big shot to Vimshati Meha, all types of pramehas. So we can give Sarivadyasava. Again, briefly touching upon the skin disorders, the carbuncles, as Gururaja sir already mentioned, complications of diabetes. So all types of eruptions, and Upadamsha, Bagandhara is there. Vatrakta is also mentioned here. So we can see and na atra samshaya, catch hold of that particular word, na atra samshaya. So the author doesn't have any doubt of using this particular medication in Vimshati Prameha or any conditions which have been mentioned. So therein. So finally, I would tell, so when we are speaking about Manjista and Sariva, they have been always an effective condition right from the time of our Ishwaridi sir. So we have seen Sariva and Manjista combinations were given for wherever there is the need of Varnya. So like Varna Vikrutis, so color related Vikrutis. So in such conditions also, the combination of Sariva and Manjista either individually or in combination can be used. So from a clinician's perspective and from the Phala Shruti perspectives, I think we can try to build up a spectrum where we can prescribe these medicines in more than one conditions. So if we can draw those lines, I think these will be very, very useful formulations. And by practice also, they are really good formulations.
See, whenever we see Phala Shruti in our text, there is a very typically the two important aspect we need to understand. Just like how Acharyas have mentioned about the various sthanas of Vata while explaining everything, Pakvashaya, Kati, Sakti, Sotrasti, Spashanendriya, everything he went on, and last it said Pakvadana Visheshataha. So there will be two things in any of Phala Shruti of any of these yogas are also that we need to observe that. What is the first indication Acharya has mentioned? That is usually the primary and the dominant first indication would be the best indication. Then ultimately at the end, if the Acharyas have given so many indications, then once again they emphasized on which is the category or the area or the disease which is very best this particular yoga is. That's why in Khadirarista they said Mahakushta, everything at the end, once again he said Sarva Kushtani. Similarly, for all these yogas, whenever we try to understand the Phala Shruti or we try to analyze the Phala Shruti, where it can be given, that needs to be taken care of. What is the first indication said by Acharya? That is the best indication. And of course, at the end of the shloka, if Acharya has emphasized on anything as an important thing, a repetition, that needs to be taken care of. That will give us a very clear idea of where to use the drug.
Yes, sir. And to add a bit more of my point also into it, if you take, for example, Mahamanjistadi Kashaya, out of all the ingredients, Khadira and Devdaru are the main ingredients which are added in like 2.4 kgs of each. Then there is Bakuchi and other things. Even in the naming of the medicines also, there's a reason why, for example, in Khadirarista, there's a reason why they have named it as Khadirarista and not as Devadaru Arista, though both are there. So probably initial few ingredients also indicate where the medicines act best, sir?
So it's not like that. Many times in many of the yogas, some drug may be comparatively better one, but we are while naming the drug, always like somebody should be made captain of the team. Something like that. The first one will be given the priority. Based on that, naming will be done. So that's the reason. Even though Khadira and Devadaru are equal proportion in that, Khadira takes the lead in manifestation of its functions. So that's why Khadirarista have been named after the Khadira. Similarly, Sarivadyasava, based on the Sariva, the name has been kept.
Moving on to the next question, we have many therapies which involve oil, starting from Abhyanga to Shirodhara to dipping the organ in the afflicted organ in the many varieties of oil called as Avagaha. Then we have Katibasti, Janubasti, etc. So the question is about food and drinks gap for food and drinks before and after any type of Bahya Snehana or external oleation therapy such as.
Okay, so first I'll take up that this one. Bahya Snehana procedures, like how much is the time gap. Okay, so here, so Bahya Snehana Vidhi is there. So Bahya and Abhyantara Snehana Vidhis are two types where external and internal administration. Sometimes it is a comprehensive package, like external and internal both are mixed together. So in the form of therapies. So as we go with Vamana Virechana pre-procedures, like we also give Snehapana for internal consumption and also we do the external therapies. So sometimes external therapies with Snehana will be beneficial, sometimes internal will be beneficial as indicated, sometimes a comprehensive package needs to be looked at. But when we are speaking about Bahya Snehana in this context, the Katibasti, Janubasti, all those things are the terms derived by us according to where exactly we are trying to pool the oil or the lubricant or the Snehana. According to that, we have termed that. We don't have classical references of Katibasti, Janubasti and all those things. So they are the Bahya Sneha Prakriyas where we have learned to pool oil in the most painful or most bothersome part of the body and give the Snehana. So when we come to that, so they are all the what we can call it as cousins of Snehana and also the Abhyanga patterns. So even after pooling, we go with the light Abhyanga Macharet Nityam. So as already our acharyas have said, Abhyanga Macharet Nityam. So that principle can be taken to most of the conditions where Bahya Snehana, that itself indicates that Bahya Snehana can be done on a daily basis. It is a part of Dinacharya. Application of oil or the lubricant on a part of the body or the whole body. So it is, we have discussed in the previous classes also. So this is a part of Dinacharya that clearly means to the entire body, the Sneha can be applied on a daily basis. Having said that, we don't have such practices, too many practices to come across where person is undergoing Nitya Snehana. So that is external Snehana. So coming to, we shall offer the same principles to Katibasti, Janubasti, Abhyanga and all those things. Abhyanga can be done daily. Katibasti and Janubasti are disease specific. When there is specific indications of these things or when the person is prone to develop. So like the person might have slight discomfort in the low back or in the knee, and the person may feel that I may develop some arthritis or some degeneration in a very near future. So in such conditions, as preventive measures, we can do it. So once the disease has set in, as curative measures, we can do it. So both measures we can do it. And coming to this time gap, so it again depends on the acuteness and also the chronicity of the condition and for how long you need to apply. So my answer to this is apply them as long as the relief is not found. Once the relief is found, you can keep it on a frequent basis, like keep giving gaps and allow the person to be relaxed and go on with your day-to-day activities. And whenever you find time, you just focus on the most. So once the pain sets in, once the problem sets in, it has left its footprints in that particular region of the body. So we need to, it keeps on constantly reminding us that this is your weaker part of the body. So what we need to do is constantly give Snehana. Snehana again translates to friendship, Sneha, friendship. So a closeness. There is no harm in pampering our body with the Sneha Prakriyas. So Katibasti and Janubasti, according to me, may be given till the symptoms subside because they are specifically indicated or well in control. Once the things are in control, you can give gaps and keep intermittent repetition. Or when the patient is absolutely fine, you can discontinue and keep a prolonged a gap between those two conditions. So for those who are prone, again, as I said, condition number 3, for those who are prone to these diseases, yes, go ahead. So until the symptoms ease up or until the person feels satisfied with the symptoms, we can go ahead. So and when there is frequent recurrences, that is another condition. Frequent recurrences, if it is there, again with some gaps we need to give. So after all these things, very important is the discipline of life, the activities of life. When we are applying Snehana and giving Abhyanga and doing Katibasti, Janubasti and everything, immediately after Katibasti and Janubasti, the person is going and driving his two-wheeler for 10 to 12 kilometers as in Bangalore on the humps of the road. So this is not going to work. But that person cannot avoid that also. So while taking the therapies and also while doing the activities, how to manage the lifestyle, so how to be very cautious, if not scary enough about that particular disorder or the problem they are having, at least have some consciousness, consciously try to manage your joints and also the soft tissues and of your body. So be very careful about that. And when we are applying this Sneha Vidhis in the old age, so in the old age, so towards where Vata becomes predominant, there also very regularly it can be applied. So whenever the problems are due to strenuous activities or jobs demanding stress on the joints, there are some jobs from profession, like a teacher may be standing from day to evening. So maybe if they're having continuous classes, a conductor in the bus may be continuously standing. So here there is a wear and tear, continuous wear and tear, and the jobs are demanding stress on the joints. In such conditions also, weekly once, if the person is in the middle age or in the early age, weekly once taking an Abhyanga at home, application of oil, pampering the joints, these are very much necessary. We need to look at the profession of the person also. And then very important is Nidana Parivarjana. Very important is Nidana Parivarjana. If the person is staying on the third or the fourth floor and climbing the steps very regularly, so that may wear and tear with the knee joint, especially if they're having a knee arthritis and especially osteoarthritis, which is a degenerative variety. So coming to the hospital, coming down the steps, coming to the hospital and getting a massage, getting a Janubasti done, getting a Basti done, going back and climbing those 25-30 steps again. Exercise is important, but here there is an active degeneration. If the person is very stubborn of using the Indian system of toilet, you can encourage them to use the Western commodes so that the wear and tear will be less. So lifestyle training, lifestyle principles, everything, so many factors need to be seen if we are speaking about the time gap between the Sneha Prakriyas, what we are giving. So you can space them at larger times if proper foods, lifestyle activities, and also the posture, stress and strain on the weight-bearing joints, and all those things are managed in a proper way. I feel the acuteness, the chronicity, and all these factors which I have discussed, and also very importantly, if discipline of life is maintained, so in terms of everything, so I think the Sneha Vidhis very less frequently to pamper themselves will be sufficient enough, I feel. So let me go to the second question. So can we eat or drink immediately after Nabhi Poorana? Again, for what condition and when you are doing Nabhi Poorana, it is important. We are looking at two perspectives here. So as the Bahya Sneha Vidhis in Katibasti and other things will totally differ from what we are doing in the Nabhi. So they are for some disease specific conditions. So here Nabhi Poorana is a totally different condition. Again, while using Sneha, we also need to see that Nabhi is the predominant seat of Pitta. So Pitta, for Pitta and Vata disorders, to balance Pitta and Vata disorders, it can be, Nabhi Poorana can be done with disease specific tailas. Again, to balance Samana Vata, mainly Pachaka Pitta, yes, and Ranjaka Pitta and also Apana Vata. For these conditions, mainly Nabhi Poorana, I feel, when we are using Sneha Prakriyas in the Nabhi Poorana, so Samana Vata, Pachaka Pitta, Ranjaka Pitta, and Apana Vata will be definitely taken care of. Diseases related to the imbalance of these subtypes of doshas, I think it should be handled well. And coming to eating or drinking, I feel, my opinion is, allow the patient to wait till proper hunger manifests. Till proper hunger manifests, the rules and regulations will be similar to Abhyantara Snehapana. So like just like the person is taking the Snehapana inside, that is the medicated ghee or something as oral consumption, we ask the patient to wait till Samyak Snigdha Lakshanas are found, the proper symptoms of oleation or lubrications are found, and once the hunger manifests, go ahead and take light food. It is the same with Nabhi Poorana also when we are doing with Tailas, because we are handling Pitta here, we are trying to balance Pitta and also the Samana Vata associated with it. So it is better to wait till hunger, natural hunger manifests after the therapy, and then go ahead with the light foods and also the liquids like a warm water, especially when, because we are handling with Pitta in small quantities, and also the foods which does not further disturb the Pitta, Agni and Vata here should be taken here. So such foods shall be taken. Easily digestible Laghu Ahara shall be taken once the hunger manifests. On the lines of what we do after the Panchakarma therapies, that is after Vamana and Virechana, the Samsarjana type of treatment. So until the Nabhi Poorana therapy, if you are carrying it as a therapy, the light to digest foods which are very light to the stomach, which can be easily digested, not disturbing the balance of Vata and Pitta, if they are given, So I think it is fine. Very important clue here is wait till the hunger manifests, natural hunger manifests.
I will take this question in a practical orientation. There are procedures as listed as a Bahya Snehana. It may be a simple Abhyanga, it may be a Kati Basti, it may be a Janu Basti, Griva Basti, or Kasheruka Basti, or it may be Dhara, whatever it is. All these comes under the therapies of Bahya Snehana. But the thing is, whether these biosnehanas are being done to alleviate some pain or some disease condition as a therapy, or whether it is taken for the swastha rakshana. That is a very important aspect we need to understand. In these conditions, once it is done, any oleation, any procedure it is done, if it is a patient admitted in the IPD or it is on a daily care basis or a day care basis when it is patient is appearing to us, then also after snehana, we don't allow the patient to go home as it is. We ask them to go for this snana with a warm water bath. Once there is a bath, we need to give the time for intake. At least 20 to 30 minutes gap is a must for any oleation, biosnehana procedures if we are doing it. After the snehana procedure is over, Samyak Snigdha Lakshana is achieved, on that particular day, patient feels comfortable, then ask the patient to go for a bath with a medicated water or a warm water or something like that, or churna mixed to the water, or even the thing which is kept for these Vedana purposes. Use those oils, water for the snana, and after snana, wait for 20 to 30 minutes gap. Then only you can go for having a food.
And also these external therapies, coming to Raghuram sir, these external therapies will have some amount of effect on the digestive system. Let's assume just simple abhyanga or full body massage. At least initially, when the vata is getting controlled externally with this oil massage, Agni takes a little bit of, it takes a little bit of strain. It puts a little bit of strain on Agni and it decreases at least temporarily because it is so involved in absorbing the oil through the, through the Brajaka Pitta. So, at least it is very clear that, for initial 30 minutes, nothing to be given. It makes sense.
Along with that, you need to understand that Pratyaksha Pramana is always better. You do yourself, you will come to know. When you do oil massage and take a hot water bath or a warm water bath, your hunger will increase because it has cleared open the channels for Vata, and Vata is freely moving now. And when Vata moves in its normal direction freely, all Agni will be supported by the Vata and Agni will increase. You observe this. Whenever a patient goes for this, particularly for swastha rakshana type of thing, whenever he goes in for an just Bahya Snehana, not Abhyantara Snehana, I'm talking about only Bahya Snehana, in that condition, after the procedure, definitely patient will have a more appetite. And of course, you need to maintain that appetite, to get the things which is not to be going to cause any disturbance in the doshas. We need to make for 20 to 30 minutes, and within that 20 to 30 minutes, you will have a very good appetite, and you can go for the regular type of diet, whatever he feels according to his capacity and his costa, you can consume, or as diet directed by the physician.
Yeah, so here I would just like to admit that I got the question wrong actually. So I thought, what is the time gap which should be given between Kati Basti to Kati Basti and Abhyanga to Abhyanga? So I thought that, and I read the next question as a different question, like can we eat or drink immediately after Nabhi Poorana? So I saw them as two different questions. So that is that is why my answer was in a different perspective. And for all of us, I think Gururaja sir has answered it in a comprehensive way. So I stick with that answer.
Coming to food intake and what should be, if the patient comes at about 9 a.m. or 10 a.m. for Abhyanga and he has not taken food in the morning and he's feeling hungry, or he's feeling a little bit hungry and thirsty, what should be the strategy there, sir?
See, very, very simple thing. Patient is coming to you on his own. It is his risk. If he has consulted us before, then we will tell them in pre-hand that what he needs to come prepared before coming to the Abhyanga procedure. So we will definitely tell them that what you need to take or not to take. Usually when morning they are just for the sake of swastha rakshana, some Abhyanga and Svedana purposes, a general health condition maintenance, for that purpose they are appearing to the hospital. then definitely we say them, you can have a light diet. We can eat little bit, like ganji or something like that, or kanji or gruyel or something like that. You can take it. No issues with that. But that should be taken at least half an hour to 1 hour earlier to the Abhyanga time. Whenever we are going to fix the thing, before that, at least half an hour to 1 hour earlier. That will be sufficiently comfortable time for the things to be done. So when patient comes by on his own at 9 o'clock, doctor, I want Abhyanga, then it is very difficult. Then we need to tell them, see, this is the thing. You eat little bit of thing, wait for some time, then we'll take up at 10:30 or 11. So that's the way we can handle the patients.
Totally agreed with Gururaja sir's recommendations and also the points. So nothing much to add. So this is a problem with walk-ins. So people walking into the Panchakarma centers and also the hospitals, and not only Abhyanga, so they are also coming with their own packages. Like I want Virechana today, I want Vamana today, I want Shirodhara. So they are coming with their own packages, Google patients. So very difficult. So as Gururaja sir rightly said, it is their problem. So, but as doctors, it is very important for us if the patients contact us or if the clients contact us, so as to what needs to be done. So people are very much cautious now. What preparations we should do before coming to an Abhyanga or for the Svedana. So proper guidance can be given. So if they have already come stomach full, so just now I had a very good breakfast and I have just come, so with the stomach full, I just want an Abhyanga. So as doctors, we have a right to take a call there. So hang on, wait, come after 2.5 hours once your food gets digested, once you start feeling light. So that's the thing. One more thing I want to add as an example. One incident took place about this instruction itself. The patient has come for Kashaya Vasti and with the stomach full of food. Where it went wrong, so we need to see. Chikitsa Chatushpada is very important here. The therapists in the hospitals are very busy. One after the other, they will be giving the Vastis, not like in our private practices. Very rush IPs and OPs also patients will be there. Sometimes they will inquire, sometimes they will not. And there is a clear instruction. There was a clear instruction to the patient. It became a medical legal case actually. So there was a perfect instruction by the doctor, no doubt about that. That when to take food, because the Astapana and Anuvasana Vastis were altered on each day. So some Vasti package was going on for a particular disorder. So maybe around 45-50 years old person. So Astapana, that day was Astapana Vasti, the Kashaya Vasti. The patient has come with full food, and the masseur also has not inquired about that. And immediately the enema was given. And 10 minutes down, it became severe complication. It was a severe complication. The patient, they couldn't manage. They had to rush the patient to the modern hospital, and those people shouted like anything. You people, Ayurveda people, you have done something, that, this, and everything. So there was a blame on the entire system. So that was actually wrong. They don't know what you people give enemas with what. So they give soap water enemas and 1, 2, 3 glycerin enema and other things, not blaming any other system. So not knowing what exactly was given, how come you people have given this enema, that enema. Doctors yelled at all doctors who had taken that patient to the hospital because they couldn't manage. The emergency couldn't be managed. After that, things even got complicated. So, but the moral of the story is the instruction was given by the doctor, but not followed by the patient. In Ayurveda, instructions are very, very, very important. Very important. Anuvasana Vasti should be given like this. Yes, it has to be given like this. Astapana should be given like this. It has to be given like this. Who tells Ayurveda doesn't have complications? One of the limbs of Chikitsa Chatushpada goes wrong. The 4 limbs of the treatment goes wrong. Definitely there is complication in any medical system. It can lead to life-threatening complication. Not only giving the instructions, but also following the instructions is very important. Nowadays, patients, we need to 10 times inquire if they have really followed those instructions, especially before the Panchakarma therapies. We have to inquire whether they have seriously followed the instructions or not. Otherwise, we will be put into very dangerous scenarios. As doctors, we also will be put into some issues where we need to face some horrible things.
So definitely when we are in a practice, we need to observe all these things and we need to give very clear instructions. But before even that, when you take up the case back on the day, it is better to assess everything personally. It is not only in this condition or any basti or anything. It may be a simple procedure also. You need to check it up before doing that. Unnecessarily hurrying is not all required. We need to go through the same old pattern of checking everything. A, B, C, D, yes, all checks and balances are being cleared. Then only you need to go further. And you observe another important thing. Our acharyas are very clearly knowing about this. If anything you're going to do something wrong, then it will going to hamper the vata first. That's why they will have a lot of complications, because vata moves in all direction in a typical way and causing irreversible changes sometime. And that's the reason so many things will be in at geoparadise condition. So that's the reason we need to be. And that's why Acharya has very clearly said, Vamana Vapat has been explained, Virechana Vyapat has been explained, Basti Netra Vyapat explained, Basti Netra Doshas explained. There are plenty of occasions where we may go wrong. That has been very clearly, elaborately explained, and what needs to be taken care of. That is also explained. So it is not today's new problem or a new solutions. It is a very age-old things. Acharyas have identified these things, and even they are given what should be done in those conditions. So, and based on that, as a practicality, we need to be very cautious, because we are in 21st century and we are on so many such type of there are protections laws and consumer protection laws are there. So should be very, very, very careful in this handling these things. And of course, we need to take care of before starting any procedures. Even in Ayurveda, it may be even bottom cases or surgeries or Ksharasutras or Agni Karmas or whatever it is, or even Panchakarmas or whatever it is. You need to understand how better we equip ourselves and the prerequisites are met before starting the procedure. That needs to be taken care of.
Safe practice suggestions, safe practice guidelines. I think Ayurveda has given the best explanation of safe practice guidelines as Vamana or Virechana. So even including sir mentioned about the Basti Netra Vyapat and also the Putaka Vyapat, everything they have detailed. So no science have given such details for safe practice. So we should know the Shastra very well. So very importantly, indications and contraindications are also there. If Acharya has given indications for Abhyanga, the same Acharya also has given in which conditions Abhyanga should not be done, in which conditions Vamana should be given, which conditions it should not be. The guidelines are always there, how much we are following that, how much our patients are following that, what is the coordination between the four limbs of the treatment, how well it is going. So it is not the mistake of any one entity here, either a doctor or a patient, or it can be from anywhere. Sometimes it may be the fate factor also, fate and the luck factor also, or bad luck factor also. Some things will creep in, so which is not under our control. But having said that, guidelines are the best in Ayurveda. At every aspect there is guideline, including diet and also the treatment regimens, the medicines, the indications, the contraindications, everything we have. So it's our responsibility. It's a big responsibility to know the entire things before going ahead into conducting or undertaking the therapies from the doctor's or the patient's perspective.
And there's a question here, like, which are the examples of light foods that can be taken after hunger manifests after oil therapies? Light foods are, recommended in, before and after many therapies. What are the common examples, please, sir? Open to both.
One is rice gruel, the other one is khichdi, and other thing, if there's any little bit of what do you call that? Some powder mixed in, what do you call, we can't call it ambli. So something like that. So very easily, which can sattu or what it is. So something like which is easily digestible. But thing is, it is also tagged with the quantum, Rashi, how much we take it. Acharya said, Gururaja sir said, Raghuram sir said, take it ambli or khichdi or rice gruel, full stomach, then this is also going to be a problem. That should not happen. Even quantum is also fixed. We need to have a very typical quantum, a material which could be easily digestible. Both things should be there. And if any are feeling any little bit of less of appetite, then you can add a deepana type of drugs like Krikatu Churna or even Jiraka Churna or Shatapushpa Churna, something like that, you can add to that. So that can also improve the Deepana condition. Digestive things or appetite. So we need to consider all these things like rice gruel and khichdi or zambli or sattu. That is very typically in the Indian continent. Typically in the Western continent, accordingly, you need to go for it. They may be using something like a little bit of boiled vegetables or something like that, or even some salads. That can also be taken.
If it is salad, then it needs to be cooked vegetable salad rather than the raw salad, raw vegetables.
It is better cooked. Once cooking is done, then it is easy for digestion compared to raw. The fibers will get broken up in the process of cooking. That will be easy for the digestion purposes.
Totally agreed, sir. There is nothing beating rice gruel and khichdi. There is nothing beating rice gruel and khichdi if they can prepare and consume it or if the hospital themselves can provide it after an Abhyanga, that will be an ideal practice. If hospital people can provide that. So for inpatients or even the outpatients, so you can even give it as a complementary Manda or Peya or Yusha, it can be given. So nothing beating that. So they are the best. I already mentioned that Samsarjana Krama. So just like the Bahya Snehana Vidhi, many times need to be handled like Abhyantara Sneha Vidhi itself. And the diet principles will be following that of the Samsarjana Krama. So Peya will be Manda. So whatever is digestible to that particular patient according to the Prakriti. And as Gururaja sir said, seeing the quantum, very important, quantity, not like go and take your stomach full. So discipline with food and also the lifestyle changes also should be managed and also should be followed during therapies, be it external therapies or internal therapies, whatever.
And what are the best things to avoid?
Very typically, any heavy foods which takes much more time to get digestion, which is guru in nature, ahara, which contains something like paneer, which contains something like cheese, something like which is buns and something like that. All these can be definitely going to increase the. I mean, even consuming a curd or lassi or something like that. So these are all guru in nature, or even plenty of milk. That is also not good here. So after these type of bias Snehana procedures, once Agni is developed or appetite is appeared, then we can go for it. And the best thing will be the rice grill. That is the best one, because out of fashion or something like that nowadays, the people somewhere there and there, oatmeal grill and something millet grill and all those things. See, oatmeal and grill and all those things have a comparatively lesser nutrition and they have got more fibers, and those who are having more fibers are difficult to digest. They fall under the category of Gururaja. It is better to give a rice gruel or manda or something khichdi or yusha, peya. These are the things which are very, very suitable for everybody.
Coming to the question, Padhabyanga includes marmas too. Of course, all body parts have marma. Should Padhabyanga or / feet massage, foot massage be suggested for patients in the clinic itself, as most people ask if they can do it daily by themselves at home? As per your experience, are there going to be differences in the results of this therapy is done self versus under supervision? Because I mean, sometimes we have to train the patient himself and ask them to do if he cannot visit visit the clinic daily, just for, like, for example, foot massage in this case.
Typically, we cannot do Abhyanga on ourselves in all the body parts. Okay. Point number one. Point number two, if we are lying down and somebody is doing Abhyanga for us and we ourselves are doing it, the effect would be typically different. When someone is doing Abhyanga, we will be more relaxing than when we are doing on ourselves. This is the point number one. Second thing, when Abhyanga needs to be done on Pada, it is very difficult. We need to bend our, flex our knees, and we have to bring the Pada upwards and do all these things. If you are lying down superficially and somebody is doing Abhyanga, definitely it will have its beneficial effects. So it's always preferable that somebody has to do Abhyangas to on a patient or a person. When there is no scope for that, or there is no people supporting the things and we need to do it by ourselves, then of course there is no other way. That is the only way we can do it, and you do it. Second thing, when we do this Padhabyanga and all those things, very typically, I never suggest for the old age people, because once oil is applied to the feet, they should remain stable in that position at least for some time. And after that, thoroughly that entire oil needs to be wiped off from this foot surface. Otherwise, it becomes a very hazardous thing and they will end up in neck of the femur fracture. So we should be very, very careful. We never allow that to the patients to do it at home in a very simple manner. Yes, you can go and do it. No, don't never guide such type of things. That is a big mistake, because nowadays most of the houses in the Indian continent, it is a floor are made up of either marble or type of tiles, or and it will be very, very smooth in nature and it is slippery. So when automatically when the tile itself is slippery and these things, on that, if your foot also has oil, and by chance if there is some lesser light, if you put something like, and if oil and water mixes up, then it becomes such a slippery that they will be thrown out of their balance, and definitely they will end up with fractures. So care should be taken not to allow the patient to do Abhyanga, particularly Padhabyanga. In case of old people, by themselves there at home. A lot of care needs to be taken to wipe off the excess oil from the Pada after the procedure is completed. And it should be, before stepping it out, the Pada should be immersed in hot water and cleansed, then only we can go out. Otherwise, it will become a lot of problematic, and you may land up even in legal disputes later. So take care, all those who are wishing to use those techniques in your spa, your clinic, or your hospitals. Take care these portions of that.
And coming to the last question of the day, when we do Abhyanga with oil, can it also be done every day on the head? Especially for the women, it can sometimes become a problem because head bath or hair wash has to be done every day. And should head bath needs to be done every day if Abhyanga is done every day, and whether a hot or cold water bath should be used for head shower?
Point number one, Abhyanga should be done to the entire body, preferably below the neck if you are doing it daily, and you can do it for face but not to the scalp. Don't do it Abhyanga to the Shirobhyanga daily. If you are doing Shirobhyanga daily, be ready to keep the oil throughout. Don't go for the head bath every day. If you could manage your social life and you're moving out every day for work and all those things, keeping your head oiled, so nothing to worry, then no issues. You can do daily Abhyanga. Of course, there is one negative thing. Where there is a megha, that is a clouds in the sky, and the condition is too cold outside, avoid putting oil or Abhyanga daily to the head. Avoid it. It should not be done daily. Second thing, whenever you do Abhyanga, if it is possible to keep the oil throughout the day, for the next day also, you keep it up, no problem. But if you are not keeping it and you want to take the head bath daily doing a head bath is not good to your head as well as your vision, drishti. It is going to spoil the vision of a person. Soon your eyes will be diminishing. They lose their power. So it is better to avoid that. So that's the reason you can apply oil to the face, you can apply oil to the whole body below the neck, and take a warm bath or after that procedure. No issues. Every day, no issues. You can do it. But when you are doing it on the head, take care. Don't do the Snehana every day onto the head. Point number one. Second thing, if you need to clear up all the oils before you go out for work, then don't apply oil directly onto the head every day. That needs to be taken care.
And assuming that the patient takes only Shirobhyanga by himself on a weekend, for example, lukewarm water is fine to use even on the hairs to wash out the oil?
Yeah, it is lukewarm water is comparatively better. It should not be totally cold, or it should not be totally hot. It is better to have a lukewarm water for the bathing.
Absolutely agree with Gururaja sir's opinion.
Okay, so that wraps today's session. Big words of gratitude to both Gururaja sir and Raghuram sir. Namaste.